What's up, Freedom Chiropractic? Dr. Coughlin here. I want to go over another case study with you. This one, we're actually sharing our Freedom Protocol very, very specifically here. So, this is a patient we had begin care earlier this year. This gentleman named Lee, he presented to our office with severe low back pain, radiating pain down his right leg. Right away, we knew this was a disc herniation situation, and we sent him for an MRI. He had been going to another chiropractor. No imaging was ordered. And so, again, that's part of our approach is that we actually, zoom out and make sure that we're not missing anything here. So we got a full set of x-rays in our office, able to determine there was very, very dysfunctional movement going on in the lower back. We sent him immediately for an MRI. MRI confirmed one of the more severe disc herniations I've ever seen. There was actually a piece of the disc broken off. You can see in the top picture there on the left, the spinal canal and the spinal cord was being pressed on quite a bit from the disc herniation there. Severe, severe pain, could barely sit, couldn't stand, really couldn't find relief any way possible. So taking a lot of over-the-counter meds, prescription meds, you name it, nothing was working at that point. So we went through our Freedom Protocol, which again, number one, we started with chiropractic adjustments to restore the proper biomechanics back to the spine. Now, again, when someone's this acute or they're in this much pain, you have to start very gently with the adjustments, which we did. We started with decompression, which is the second part of the Freedom Protocol. So again, chiropractic adjustments, number one, spinal decompression therapy, number two. And then again, we immediately started with soft wave tissue regeneration therapy right away as well. So again, the soft wave tissue regeneration, we utilized over the discs that were torn and damaged. So again, when a disc herniates, the outer layer tears and part of the inner disc material leaks out into the spinal canal. So it's swollen, it's inflamed, and it irritates the entire area around the spine there. And so a lot of pain, a lot of inflammation, all of the above. So the soft wave helps to decrease that inflammation, decrease the pain, and that's the initial response. And then long term, it actually helps to increase blood flow to the area so that the disc can actually form a scar and heal over so the disc doesn't continue to re-herniate. So again, that was the third piece of the Freedom Protocol. And then number four was we customized stretches for at home for Lee. So again, everyone responds different to different stretches. So we have an entire diagnostic protocol that we see, okay, is this person more tolerant if they're in a flexion type movement, or are they more tolerant in an extension type movement? So again, we prescribe stretches at first for them to see what we can do to help, again, get their body moving better and reduce that pressure on the nerves in the spinal cord. So again, if you look at this was a big case. So again, we started working with Lee 3 times a week, then down to twice a week. And at 4 months, so you can see 120-day follow-up here. Freedom Disc Protocol, which included chiropractic, spinal decompression therapy, soft wave tissue regeneration therapy to the injured area, and then personalized stretches and exercises. Again, you can see bullet point 1 there. Pain subsided by 50% after 4 weeks. 100% gone after 90 days. Now, once the pain's gone, typically there's still going to be some numbness or tingling in the leg. And that's what we mean by radicular symptoms. That took another month. So after 4 months, that was all gone. Again, number 2, you'll see that point there. Lee went on a cross-country road trip 4 months after the injury and hiked through national parks. Again, at this point, he was regained. He was pain-free up until this point, continues to be pain-free. 100% fully functional without drugs or surgery. I can tell you without a doubt, had he been to a spine surgeon when this initially happened, he would have had a surgery on his lower back where at a minimum they would have actually removed part of his disc. In a more aggressive scenario where a surgeon was more aggressive, they would have put rods and screws in his lower back to try to stabilize that area and relieve the spinal nerve and spinal cord pressure. We were able to do that conservatively with the Freedom Protocol. No more drugs, no more surgeries, nothing like that. He's back to 100% function. Again, you can see in his words, I was in excruciating pain in January. I could barely get dressed. By May, I was driving cross country without any pain at all. Freedom Protocol helped me get back to normal within 4 months. Guys, this doesn't happen overnight, but with that process, with the Freedom Protocol, we see phenomenal results. Again, with chiropractic, decompression therapy, soft wave tissue regeneration therapy, and then we personalize stretches and spine strengthening. We do need to get strong again to prevent relapses. That's all part of our Freedom Protocol here at Freedom Chiropractic. Again, if you know someone dealing with back pain from disc injury, herniation, disc bulging, scoliosis, any of the above, we're here to help. Again, you can see our contact info there, Freedom Chiropractic, Mount Laurel, New Jersey.